When I was young, I suffered severely from period pains, and the bleeding lasted more than a week. Heavy flows, sometimes twice a month. I still remember those terrible years, those never ending bleeding. GPs that my mother took me to once told me that when I had babies, the bleeding would lessen. It didn't happen. And for years, I lived in dread of my periods. And then suddenly, it all stopped when I turned 50. But with it came mood swings, happy one moment, crying my guts out the next, the hot flushes, weight gain, poor body image, reduced confidence. The list is endless. My girl said I was a terror to live with, but no one understood what I was going through. And I couldn't explain this sudden change in my body, my attitudes toward them. I also wondered what my mother went through because by that time I had left home and I wasn't there with her. What I do remember her telling me is that suddenly her youth had slipped by and she was an old woman. Those days, 50 years old was old. In India, you retired at 58. So different from now. I'm still working. Hi, I'm Saleha Singh, and this is Chai, Chat, and Community. Meet the gorgeous Dr. Talat Uppal, a woman's health expert, and today we are chatting about menopause and how it affects us women. Thank you for joining me, Talat. I'm so excited, and we've been chatting for a few months now, but ultimately you are here.
Thanks, Alia. The pleasure is all mine. It is always such a joy to support our communities.
Thank you. So, Talat, before we start talking about the most important subject in our women's lives, once you are middle aged, because that's when menopause actually hits, when you are at your prime, basically, career wise, children have grown up and you have time to yourself, menopause strikes. So, before we start talking about it, please tell us about yourself, your journey from Pakistan to Australia, and how your experiences influenced your career path.
Thank you so much, Salia. So I was born in Pakistan, and then my parents migrated to Nigeria and Africa, and I grew up there. I did my medical degree there. And then I got married and came to Australia. My husband had migrated here in 1995, Salia. And so I did my gynecology training here in Australia. I have always, since I can remember, did want to help people and particularly women in some way. Even though when I was younger, I obviously didn't have the clarity of how I wanted to do that. But advocacy is something that I think was always important to me. And I found that there has been more and more opportunity to do that. And I find myself very privileged to be able to do that.
And I'm privileged to have you. I mean, we need an expert like you to talk to our women because this is still such an unspoken subject. So why did
Absolutely.
you?
So much taboo, so much silence and shame around general menstrual discussions, but
Yeah,
particularly menopause is such a, taboo subject.
absolutely. So why did you study medicine and especially concentrate on women's health?
Yeah, I wish, Salia, there was some exotic answer I could give you, but I'm the child of Desi parents, and I mean this in a very kind way. I had the two usual options that I think many people in our generation did. And so, of those two, I chose to do medicine, and there was some, let me say, gentle encouragement from my parents to do that. And I have enjoyed the journey, and I'm very grateful to them. But it's not like jo ab hamare bachon ke paas, like thankfully there is a much more, at least for me, I haven't put any sort of expectations or pressure on my children to choose a particular thing. I want them to do what gives them joy. And then when I got into medicine, Salia, women's health, I fell in love with because I was attending birthing unit, and in the context of a developing country, there was so much that mujhe पहले दिन ही पता लग गया कि this is like fish in water for me, and that the disadvantage that women were facing throughout their life trajectory was just so obvious in terms of their empowerment, their ability to input into their reproductive decision making, you know, the number of children, their access to contraception. It was such a life trajectory issue. So, and sometimes, Salia, it has been difficult for me because, you know, the training, especially now, it's getting a bit kinder for doctors. The hours were quite tricky, and then having a family, the balance, and all of those things that I think a lot of female doctors do have to juggle. But I would say I have never looked back and thought, okay, I wanted to do something else, or there was any other path for me. I do find it very fulfilling.
Oh, this is fantastic. So let's talk menopause.
Okay.
Um, I read an article from the UK where a dietitian said women from India and Pakistan tend to have menopause early. Is it true, and why?
Yes, so it is true in a statistical context. So if we look at the average age of Caucasian Australian born women, it is 51 years, Salia, that we are expecting the majority of women to become menopausal, even though it's actually a range. It's 45 to 55. But there's very limited research in the South Asian context. But what we do have is showing somewhere between 46 and 47. So, above
Wow.
socho 5 साल, there's a 5 year difference between the average, 4 to 5 year difference between the average that, you know, we as South Asian women will be expected to become menopausal. And that is quite significant. We are going to unpack the benefits of estrogen on our body. And so when we look at that, that already puts us as a, you know, we're behind in terms of if we become menopausal early.
That's also the, like, we are at our prime in our mid 40s and 50s, kids have grown up and we can do so much more. And yet, menopause sets in between, say, 45 and 50, like you said. We are overlooked for everything, promotions, people don't understand the mood swing. I mean, yes, times have changed with work from home options. But if
Yes,
you're in a medical profession like you can't work from home. You have to go into work
absolutely.
every day. You know,
Absolutely. And Salia, I think menopause, obviously, like any other situation, can be very individual. So if we look at the numbers, it's basically 60, 20, and 20. So 20% of women, unko koi masla nahi hota. So 1 in 5 women will say, oh, bas hamara period khatam ho gaya. That is it. We're very jealous of that
yeah,
group. Then there is another 20% on the other side which of the spectrum, which is
yeah.
they are miserable. So between 20 and 25% of women are absolutely struggling, you know. And unke liye I actually keep a tissue box right next to the chair where the patient sits. Because mujhe pata hai ki she will sit and then she will just completely, you know, fall apart because the women are so resilient. They've been putting up with it, coping with it, but really those symptoms are nasty. And then in the middle, we have 60% of women, which we technically are defining as moderate to, you know, mild to moderate symptoms. Kenge kuch some days weren't too bad, some days were a bit challenging, you know, we so they have a variation of symptoms, but mostly they are, a lot of women are putting up with those as well, unfortunately. But compared to the severe group, they seem to be having less severe symptoms in that context. So that's how the spectrum of symptoms are usually spread.
Last night a friend said to me that we women, we are born women in a South
Hmm,
Asian culture where,
hmm,
having a male child is still the preferred
hmm,
child to have. Then
hmm,
you get your periods. For some of us, it's terrible, like me.
hmm,
Then you have childbirth, so that's 9 months.
hmm.
And no matter how much we say women have progressed and, men are helping, the majority of the child rearing is still on us women,
Oh, the physical
along
and
with
the
a,
mental
yep,
load.
yep, yep. So, and we still have jobs, and then
Hmm.
you are hit with menopause. So there is like, where do you rest? Where do
Very
you
good
rest? And
question. question. That's a very good question. And I think, Salia, what is becoming more obvious is not just the menopause, but actually the time leading up to menopause can also be very challenging for us. And like we mentioned at the start, as South Asian women, we might be predisposed to earlier menopause, but that means that the whole yardstick shifts, and it means that we will then most likely be exposed to an earlier perimenopause. And the perimenopause is the phase. So just to go through some definitions, menopause is actually a single day. It's the day of your final menstrual period, but it is a retrospective diagnosis. So एक साल बाद हम कह सकते हैं, oh, okay, I was menopausal. That's when I became menopausal. So it's when you have 12 months without any, 12 consecutive months without any menses. But the point leading up to that day and the 1 year after is called perimenopause. And perimenopause can be anywhere between, for someone it might be 4 years, for others it might be up to a decade. Ab agar hamara average, national average is 46, that means that the decade before is taking us to our mid-30s. And usually if you go to a doctor and you're saying, look, I'm feeling not quite myself, they may not always connect with this 38-year-old woman is actually maybe showing some symptoms of perimenopause. Or फिर इससे जो और मुश्किल होता है with perimenopause, which is actually the start of your irregular cycles in your menses. That's how it's defined. It's actually a clinical diagnosis. So then I think what makes it harder is because there's a lot of overlap. There's overlap with many medical conditions. We can sometimes be sort of think that they're life stresses, like you mentioned earlier, where we may be caring for children, we may be in a busy job, we might be having aging parents, we might have been multitasking so many things. So then you kind of sometimes say, oh, maybe I'm just fatigued because I'm doing that, rather than recognizing. So kabhi the women many times don't recognize themselves what phase they're going through because they are putting it to the life stresses, which of course can be contributing. It's a very complex space, isn't it? Magar sometimes, unfortunately, the clinicians also don't connect because at times, हमें जब awareness ही नहीं है, we might not even offer. So I always say in education sessions to GPs who, are very well intentioned to say, okay, she may not volunteer. So if you don't ask, then no one is going to uncover that there's actually a problem going on.
Thank you. Wow. So back to menopause, what exactly are the symptoms? Because I know I had lots of symptoms, which I didn't realize at that time.
Yes.
10 years later, I now know what's happened to me.
Absolutely. There are more than 50 symptoms now of menopause. And basically, the reason why most of them are occurring is because our hormones are changing. तो क्या होता है कि when we are born with about 1 million, and this is not a very efficient process. We are born with 1 million eggs, roughly between 1 and 2 million eggs. And after puberty, we basically ovulate, and ideally we should be ovulating one mature egg and the left and right ovaries alternate. And then in our perimenopause, क्या होता है कि the ovaries are starting to basically not function in a very functional way, and the eggs are actually declining, and the eggs, Salia, are what produce the estrogen. For some women it's almost described like a roller coaster, the perimenopause time and also the postmenopause time, but more particularly the perimenopause, because when we look at the hormonal levels, Salia, they're actually fluctuating. So, and what happens is, but if you step back and look at the graph, it's trending downwards. And then after menopause, kya hota is a little bit more same, because wo phir low levels are consistent. So you're not having so much of the variation and the fluctuation. Because many of the cycles in perimenopause are actually what we call anovulatory. Isme under release nahi ho raha. So they're not functional cycles. What happens is, the symptoms can actually start, for many women, they can start with actually the irregularity of the cycle. Ab you and I know that periods में काफी सारे variation factors होते हैं. What is the length of the period? The period can get longer, and more than 8 days is considered abnormal. The periods can get more frequent, and often at the beginning they become more frequent, and then they start to become more spaced apart. So if they're coming around, Salia, more than 24 days apart, and these are the technical definitions per our FIGO, which is the International Society of Gynecologists. And वो कहते हैं कि 24 days से ज़्यादा करीब हो रहे हैं या 38 days से ज़्यादा apart हो रहे हैं. So those are infrequent or frequent cycles respectively. And then you can have the flow changing. So the periods can become lighter or heavier. And that in itself has its own consequences. But किसी को अगर, if you're bleeding heavily, then you're likely to become iron deficient. Then you're already fatigued from life stresses plus joys of perimenopause.
Yeah.
उसके ऊपर से life iron deficiency भी हो जाए, and then anxiety from the periods and from the perimenopause. This is not a good combo. So basically, as far as the periods are concerned, it is very important to address if we think that they are becoming significantly abnormal. So apart from
I know I had terrible iron deficiency. I know
see, and
that, yes.
that really
And
does not
hemoglobin,
help.
and my hemoglobin just plunged.
See, and that's a very, very unkind space for women because
Yeah.
they are so fatigued and already they're battling so much. Uske upar se ye bhi joys hum, which are very fixable issues. So we'll come to that when we talk in management. So when in response to your question around symptoms, Salia, basically estrogen affects every cell in our body. So when you're thinking about symptoms, you can start from the brain. But some women will say that they have brain fog or they're having memory issues or mental health impact is quite common. They can say, look, and there might be people that had a tendency to depression before, had an element of that previously, but they're saying, I'm just so much more, my mood is low, I'm so grumpy, I'm irritable, I'm really anxious, I'm sitting up at night worrying about things that wouldn't remotely bother me before. So that whole thing is where you can have a real escalation, and this can be more common in South Asian women. And another common thing, Salia, that we get, which is a bit less with South Asian women, to be honest, in the studies, is vasomotor symptoms. So basically that means कि हमारा जो जैसे फ्रिज का thermostat होता है या एक ऑफिस का thermostat होता है, गाड़ी का होता है, we have one in our own brain, and that is somewhat influenced by estrogen. Now, when the estrogen is doing that, we can get hot flushes, we can get night sweats, and these make you uncomfortable. But Salia, they also impact your sleep. आप रात को उठ रहे हो, गर्म हो रहे हो, अपना वो कंबल उतार रहे हो, फिर कह रहे हो अच्छा मुझे ठंड लग रही है, now I'm changing the temperature. So all of this is very disruptive to sleep. So the hot flushes and night sweats in itself can be a problem, but the consequences of some of the symptoms can actually worsen other symptoms. So for example, our sleep can be bad because we're perimenopausal, can be worse because we're now more anxious, can be worse because we're getting up at night because of the hot flush, or the estrogen also affects the vaginal area and the bladder and all of that area. And so what happens is sometimes women are getting up more frequently to pass urine.
I do that.
Or the incontinence starts, or basically there is vaginal dryness, and so that whole thing can also impact your sleep, can impact the way that urinary symptoms. And for women who are sexually active, they might report we don't feel like having sex much, so it's affected the libido.
Yeah.
Or they might find they're actually very dry, so they don't mind having sex, but sex is very painful, and so then that becomes a barrier for them. And then they might be having relationship issues anyway, or they may be having them compounded because they are struggling, or they might be impacts from the sexual side that is impacting onto the relationship. So you can see how intertwined all of these factors are.
Yes.
So iske alawa, one thing that is quite common in South Asian women is actually joint and muscle pains. So they might report ke hamari hadiyan dukh rahi hain, my shoulder is giving me trouble.
Yes.
Yeah, so lots of aches and pains, and so and then tiredness, fatigue is one of the others. So when we look at South Asian women, we will find that there is a higher reporting of fatigue, of anxiety, of joint and muscle pains, and bladder related and vaginal related symptoms compared to the vasomotor. But at the end of the day, every woman is individual, and we can have any combination or none of the above symptoms that I've mentioned.
I had a lot of what you said, the mood swings, the vaginal dryness, getting up at night, joint pain. It just, I have to now take cortisone injections because of joint pain. So yes,
Oh
all
my
of that.
goodness. Yes.
Yeah,
So,
yeah,
so that's such an important thing to be mindful of, that it can, of course, it can be an arthritic process as well.
yeah.
And sometimes it's actually a pathological condition, a medical condition, another diagnosis. But at times it can just be estrogen deficiency. And estrogen deficiency also worsens, Salia, some of the other medical conditions we might have. So it's almost like मैं इसको ना as an onion सोचती हूँ कि there are layers of
Yeah.
different things that we have to really be mindful of.
Thank you. Very, very well explained. Now I know, and I can tell my husband this is why. Um, so I want to ask you because again, I mean, we all take our personal experiences forward, isn't it? And
Of
try to
course,
make sense of what is happening.
of course.
So, does menopause affect mental health?
Mhm.
And how is it typically addressed? Because, like I told you, I put on weight, I
Mhm.
had body image issues.
Mhm.
I, I kind of second guessing myself because I'm
Mhm.
losing my youth. You
Yes.
see wrinkles coming up. I remember the only thing my mother said because I had already left home is that she had lost her youth, and
Yeah.
and and, and that's that I mean no some people may say it's vain, but we are all vain. We want to look our best, not for
Of
others
course.
but for ourselves.
Of course. Of course. And Salia, I think that is where. Sorry, do you mind if I just shut the door because I don't want the
Oh, no, no,
people?
no, 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 absolutely.
Sorry. Sorry. I
No,
actually
no.
do. Excuse me. Thank you, Salia.
No, not at all.
So yeah, so the mental side of things is so important because, like you rightly said, Kay, it is, it's a situation where I see this almost every day in our practice. Kay, women will say, Kay, I just don't feel myself, and I feel so flat. I feel like, or they will say, look, I just feel so worthless, or I feel like, and when you look at the bigger picture, actually that person might be in the prime of their life, and this is the last time that you'll be expecting her to feel like that. But I think what we feel is that it can be the estrogen changes can be so challenging for women. Okay, it just exposes you to a number of mental health things which can worsen. Generally speaking, the what we're finding that with using, for example, hormone therapy for a group of women, they do report that their mood is better, or they're feeling much more like themselves, or their brain fog is improved. And whereas a group of women actually do need antidepressants, need others. So it's never that simple, Salia. It's always a little bit complex, but we find that this is a space that you can help women significantly in, but they have to first seek help. And I think the
Yes.
problem with us is that sometimes we just want to carry on like there isn't a problem. So we haven't normalized in our society to ask for help. And so there is so much trivialization of symptoms कि हमें, क्योंकि our conditioning is like that, just put up with it, ठीक है गुजर जाएगा, this is a natural phase. Sometimes there's a little bit of lack of awareness of what the options are, or what the health system is there to support you. And at times, unfortunately, there's some patriarchy in medicine, there's gaslighting in medicine, which is often unintentional, because even as clinicians, even as a gynecologist, I will say to you that a lot of the menopause related work I had to upskill myself in. It wasn't that I was taught a detailed amount in medical school, or even during my training that I had a huge amount of training on that. It's when, because my interest, Salia, is looking after women with abnormal bleeding. And because that is clustered to perimenopause and to adolescence, I was seeing a lot of perimenopausal women. So when you see women, you learn from the women that you care for. And that would make me think, acha, hum inki plumbing bhi help kar sakte hain. We can reduce the bleeding, we can stop the bleeding, we can replace the iron. But there's still an element that's missing. She's still reporting vaginal dryness. She's still reporting, that she's not feeling herself. There's still other things. It's not just as simple as heavy bleeding and you've managed that. That was how, Salia, I got exposed to this, and I understood understood more, and then I upskilled myself, and I thought, oh my gosh, it's a lost opportunity if women don't know about all their options available.
Yeah.
And the other very important context is that one is around quality of life, is around demanding a good quality of life and saying, nay, nay, you know what, I'm not feeling myself. I really need to seek help and try to optimize my quality of life so that I'm thriving, not only physically, so I'm not tired and, like so exhausted, but also emotionally, that I'm at my, I'm more optimized, but also from a productive point of view. The studies show, okay, women leave the workforce, or a certain number of women retire early because they're just not, able to manage that anymore. And that's very sad, because kitna talent hai in our women and in our communities. So that's one factor that is so important to address the quality of life. But the other very important factor, Salia, is basically your future self and preventative health. As a young person, what opportunities do you have to improve your bone health, to improve your cardiovascular health, so your heart, and basically, how can we and we're living longer. So if you look at the average lifespan according to women born in India, it is now about 69. If we look at the Australian numbers, according to the Australian Bureau of Statistics, it's actually 85, almost 84, 85 for women.
Wow.
Oh yeah. So we are going
That's
to,
really
अगर हम
interesting.
100 साल वापस जाए ना, पीछे जाए, we used to have a life expectancy somewhere around 50. So
Yeah.
we are not essentially by nature designed to live 1/3
Live
of our
longer.
life
Yeah.
after having children. It's almost like our job was to have children and then
Yeah.
tuck, so but basically now what we want to do is, we really, like you said, we want to thrive in that last 1/3 or half of our lives. So that's, I think, where it's really important to not only focus on your symptoms and improve those and seek that help. And if that help is not forthcoming from the first place you go to, then please, don't accept that, and demand a good quality of life. But the second thing is that we are more likely to have bone related osteoporosis,
Yeah.
being South Asians. We are also more vulnerable to metabolic issues. We are more at risk of, we don't have the world's best DNA, I think, if I can put it that way. हमें कुछ genetic and some racial gifts मिली हैं, let's put it that way. And so we are more likely to have diabetes. We are more likely to have cardiac issues. So for us, not only the fact that we might be becoming menopausal early, and this is not researched. एक तो पता है सालिया, औरतों में ही research इतनी paucity है, because until recently all research was on only one type of person, which is the white man.
Yeah.
And अब शुक्र है कि we have started researching women. Even, can you believe that even in the lab when we were researching, researchers used male mice. But even the rats or the mice were not women, so were not female. So
Talk about misogyny and patriarchy.
so we have a paucity of data. Magar within that, ab shukar hai aurton pe, we're starting to. I'm very happy that there's so much conversations currently, and there's been a parliamentary inquiry on
Yeah.
menopause. But the point I was trying to make is, within that, us South Asian women, again, we suffer from a very lack of data, lack of research, paucity of research. But we do know that we have higher risk of certain conditions. So even more likely कि हम सोचें, even more important that हम सोचें कि अच्छा, while we're young, what can we do that our future self, 20 years future self, is going to thank us for?
Yeah. Perfect. We did talk about HRT. Do you want to talk a bit more, or is that enough?
So, okay. So hormone therapy. So before that, if you don't mind, Sally, I would like to talk a little bit about lifestyle.
Yes,
So
absolutely.
yeah. So when a woman comes to us with perimenopausal symptoms or postmenopausal symptoms, depending on which symptoms are front of mind for her and what are important to her, and also basically what her individual risk is. So at the end of the day, as clinicians, our role is to give options and have a detailed risk benefit, and then respect the woman's preferences and choices, and so that we can make a plan. And I often encourage patients to think, okay, think of a plan A and a plan B, and put your quality of life as the important thing. Kabhi, yes, I agree that we are more fixated on the side effects of something, or the problem with something, or perception that it's unnatural. But being anemic is not very natural either. Being fatigued, or saying main ye kar nahi sakti, main kaam pe focus nahi kar rahi, that's also not a good baseline. So I often encourage women to actually seriously think of their baseline. If this is not a kind baseline, you're not enjoying life, then maybe trying some of the options that are available is actually a good idea, because it might move you out of that very negative cycle that sometimes women find themselves in perimenopause. So lifestyle factors, Salia, there's very mixed sort of literature or research around some of them. So which means that kabhi they're not that they're saying of course, we know that there's so much value in eating well, healthy, in exercise. In exercise, not only improves our bone health if it's weight-bearing exercise, but also basically minimizes our risk of chronic disease. There's so many benefits, improves our mood, improves our well-being. But the point I'm trying to make is that sometimes they're not directly affecting the menopausal symptoms, but they're increasing our reserve to manage them, or they're minimizing our distress. So women might say, look, since I started mindfulness or yoga, or, there's more data around cognitive therapy that is been shown to be more beneficial, but cognitive behavior therapy. But what I'm trying to say is that it gives you better reserve to manage the perimenopause. So at the end of the day, if the woman's feeling better, or is feeling more, she's coping better, then that's still a win. So apart from that general, sleep hygiene, avoiding triggers, like for example, for hot flushes, some women will say, "Ki mujhe spicy food, caffeine, alcohol." They will identify what triggers them. And also some simple things like, wear dress in layers. Aksar women will wear a light cardigan. Garmi lagi to utar diya, thand lagi to pehen liya. And,
I do that.
Like a fan in the bag, and to have, just that sort of simple things that we can do to make us more comfortable. And then I think the whole issue around menopause therapy is basically what it is to try and replace or to optimize some of the hormones that we have in our body. And kya hua Salia is because in 2002 there was a major, basically more American-led research that was published, और उसमें बहुत it revolutionized, unfortunately in a very negative way. It was actually quite a flawed study. It was looking at 63-year-old women, which are often not our starting point. Currently, we're having the discussion much earlier, a decade earlier, if anything. And so that kind of revolutionized, and there was a lot of media around that, and it was portrayed as quite a negative thing. Or उसमें क्या हुआ है कि we've had women suffering, a whole generation of women have suffered through menopause क्योंकि उन्हें लगा कि oh my God, it's going to give me breast cancer. And I always say to women that of course breast cancer is so important to reduce and to be mindful of, but it's not a single lens. When you're managing perimenopause and menopause, just avoiding breast cancer is not the only lens. And many women don't actually know, Salia, कि हम मरते किसने? We die from cardiac events. So more women die from cardiac events than they do from breast cancer. Even breast cancer is 1 in 7, 1 in 8. It's so common. Yep. But what kills us is actually a cardiovascular disease. So I think appreciating everything in context and then deciding, okay, what risk am I prepared to take and what benefit am I seeking helps you make that decision. So hormone therapy essentially has 3 hormones. It has estrogen, progesterone, and testosterone, okay, in different combinations and quantities. Now, if you have a uterus, basically what we're primarily trying to replace is estrogen, Salia. So, because the main hormone that often is related to most of this or many of the symptoms can be estrogen. So estrogen can be given in different ways. It can be given as a tablet. It can be given as through the skin. And the skin is the safest way of taking estrogen because it doesn't increase your risk of clots. I'm not talking
Okay.
about period clots. I'm talking about clots in
Yeah.
the legs
Yeah.
and in the
Clothes.
lung.
Yeah.
Okay? So those sort of clots do not increase because of the way that it's absorbed. सीधा हमारे bloodstream में जाता है. It doesn't go through the liver. So it's a very good way of taking estrogen is either through a gel or a patch, and that is the safest way of having it. Now, anyone with a uterus, so estrogen is quite kind to most cells in the body, but the uterus may not, it's like fertilizer. So we have to really think, okay, now we don't want to be helping this patient and then give her
Yeah.
uterine cancer. So we have to sort of usko na marry karna padta hai with progesterone. For somebody that has a uterus, we have to then sort of partner it with progesterone. And so, amongst the different progestogens, we have one that is called body identical, prometrium. And there are very many different ways of giving progesterone as well. We can give it as an IUD, we can give it as a tablet, we can give it, in a different context. But again, one of the ways of making this safer, because what we're constantly trying to do is get the best results in terms of symptom relief, but also create the minimum risk or harm for that patient short term and long term. So prometrium is one of the what we call body identical progesterones. Salia, the hormone therapy, think of it as a very dilute version. It's not like the pill. The pill is quite heavy in terms of comparatively between the two options. This is a more dilute amount of hormones, and it is more sort of matched to body identical hormones are more matched to what we should be having as midlife women. So I feel that it's a better matched option, but it's also kinder, more breast friendly. There still can be some association with breast cancer, but often those risks are not as much as we fear. So, for example, for some progesterones, and the breast cancer risk often is from the progestogen part, and they can be, for example, I'm giving an example, like up to 3 in 1,000. So, Salia, first karo ke the condition breast cancer is 1 in 8 women. So let's say 125 in 1,000 will get it. So on some versions of hormone therapy, 128 in 1,000 women might get breast cancer. So many women will say, oh, look, that means that the majority of women who are taking hormone therapy that get breast cancer would have had it anyway. So what we've had is that women have sat like this, oh, I don't want to get breast cancer, but not understood that the risk is so tiny.
Very
And
little.
that
Yes.
risk is also from increased BMI.
Yeah.
So it's also from drinking a lot. It's also from family history. So there's a long list जो उतना risk लाता है. So I guess it's more to decide, well, which things are important. And in the same time, estrogen is cardioprotective. It actually helps our heart if it's given early, if we're within the 10 years of menopause starting, and certainly in younger women, it's actually protective. And so it's also an investment in bones. We know that osteoporosis is a reality and falls are a reality, and when women fall in their older age, this is associated with not only a quarter die within that 1 year, and a quarter have very significant morbidity after that. So these are very real health issues that we have an opportunity to minimize in midlife. So even though the primary focus is around symptom relief, but I want you, when you go to your doctor, to think, what can I do at this point that's going to be preventative, good preventative health for me?
Thank you. Well, in 37 minutes, I have learned so much more. Um, Now, the most important thing, which we never
Yes.
talk about, is cultural and social. Uh, how do cultural stigmas around menopause affect South Asian women's willingness to ask for medical advice? It's like we have done that, been there, and we are not going to talk about this anymore because it is again something that we, like having 10 kids. I mean, having 10 kids is your prerogative, but I saw my aunt, my pupu.
Hi.
Uh, she had 12 children,
Oh my
and
goodness.
she was so tired. And I
Yeah.
remember my mother telling my papa that, what
Huh.
is it? You need
Huh.
to stop at 2, 3. And
Absolutely.
because he could see my aunt just kind of disintegrating, giving birth every 18 months. But his argument was he was a single child, so he wants lots of children, but
Right.
not once considering,
Hmm.
You
No,
know,
it's
what a
it's
woman wants.
yeah. So I think that's so important, Salia. You raised the elephant in the room. Okay, there are so many good parts of our society, but unfortunately, there's a lot of shame, taboo in general with discussing menstrual health, and particularly with menopause, because you mentioned it earlier, like it's perceived as a loss of youth,
Yes.
whereas we can actually change our mindset. We can say, look, we're in the prime of our life. This is the time that we are actually, we are, I think so. It's framing of the bigger picture, some realistic expectations. There are some changes in body fat that occur with perimenopause and with aging that I think it is important. Not that I'm saying it's important to accept, but it's so important to manage weight and to manage exercise and healthy routines. But it's also important to be realistic. Sometimes I find that people are wanting the 23-year-old version of yourself, but actually no, we are in a different phase of our lives, and this is also important to embrace this. But mujhe lagta hai ki because people feel shame to talk about it, and some of it is stemmed in religion, is stemmed in culture, is stemmed in familial. Some families are very conservative, they don't want to talk about anything, period. I mean, even my mom is so progressive. मुझे कहेंगे तुमने फेसबुक पे क्या लगाया था, तो I'm like, Mommy, like if someone wants to, they should just unfriend me. वो नहीं देखना चाहते, मैं गाय की हूँ,
Yes.
मैंने कौन कोई वो
Yes.
लगाया है?
Yes.
Some medical topics. So which she stopped doing, bless her. But earlier on, she would get a text and say, "You Taro, ये तुमने क्या लगाया है?" So like this is from a
I can
very
understand that.
caring
Yes.
family. I'm like, okay, like okay, fine if your brother's seeing it, or my sister is seeing it, or whoever. Like, don't worry about that. So, but that is how that is perceived. Okay, these are women's issues, are something to be hidden, to be not having a conversation. And that's why I think, Salia, this is so, I'm so grateful to you. Okay, you are actually bringing this conversation, and this is exactly what we need, to women to talk to their friends, to their sisters, to their cousins, to their doctors, and also actually for us to have peer support groups or more
Yes.
community facing, और मुझे लगता है कि until that leadership comes from our own community, because sometimes, because the research is done in Caucasian women, because a lot of them, we don't see the representation always of women of color in certain forums, or so then we don't also sort of have those nuances जो हमारी cultural हैं, that I think it's so important to address and acknowledge. Okay, we need to minimize the shame and the taboo and treat this like a medical condition.
Yes.
And
Absolutely.
similarly to periods, Salia, because I look after heavy periods, you will not believe how much normalization there is of that. मतलब वो औरतें बैठती कहेंगी, oh, yes, I have heavy periods, but just 2 days. Only 3 days. So even the words they use, na, they are,
Yeah.
oh, हाँ,
Yeah.
2 दिन मैं घर से बाहर नहीं निकल सकती, मगर खाली 2 दिन है. I'm like, it's not only like 2 days every month. You're not going
Yeah.
out. It's a big thing, and we can fix this for you and with you. So I think some of that is not trivializing and culturally understanding. Okay, we have to be the change.
Absolutely. Yes. And it's women like you and me and many others I know who work with me, who are my friends. We are all the change agents for our future generations and our grandchildren. You've talked about, community support groups, and I will put the links that you have sent me earlier this morning. Last question, most important. Uh, I am a very proud mother. I love my girls to bits, but I know now that when I had menopause, they did not understand as I did not understand. I
Yeah.
don't. Um, how can we get family members to understand what we are going through?
I think part of this is the general awareness, and
Yes.
very, very good question, because मुझे लगता है कि just having the patient feel more comfortable is not enough. It's actually, we're always in an ecosystem, and we need to take them with us on the journey. And they also have a responsibility to seek care and seek help. You know what I mean? Or seek awareness of what is going on to their mom, or, sometimes it's the teacher in school, or it's someone else that they know, an auntie. So, but our team is very interested in menopause, and our admin Sarah, who is very interested in this actually did a search of school curriculum, and menopause was not even mentioned in the PDHPE that she searched. So imagine children are going through all of the school without even mentioning or
Mentioning
discussing
it.
this as a concept. So I think this is a big systemic and structural issue in our society. We are thinking of menopause as one midlife woman's problem, but actually it's not. And the men
No.
need to be part of that conversation as
It's
well,
the
not
whole
only our
family. Yeah.
children, whole family, and it needs to be awareness for the whole family. So especially to my patients, sometimes I actually encourage them, if they are comfortable, to bring their loved one with them into the consult, sometimes only because it provides some support for them, because they might be sharing details that are quite intimate or for them daunting to share, but also you have that support, and we get a potential to educate or to help raise awareness between the people who are around her as well, not just her. So I think that we need to make resources, Salia. And at best I find that we have translated pamphlets. Acha, Hindi mein translate kar diya, Urdu mein translate kar diya, but do we actually have lived experiences of women that can share? Or what I find very helpful is a panel based discussion. Jisme doctor bhi hai, patient bhi hai, talking about their journeys, and they are from the culture that we're trying to support,
Yeah.
rather than
Yeah.
एक pamphlet को translate करके क्या अच्छा ये जाके पढ़ लो. So I think our way of raising awareness also has to change. We have to go into schools, we have to go into temples, we have to go into mosques, we have to go into where our community functions are, and try and include this as a discussion point.
Thank
And
you.
social media, of course.
Of course. But social media it's incredible, I put up an Eid post
Mhm.
and I had 300 people commenting on it. And I love it because I keep saying I come from an interfaith background. My mom was a Hindu, my dad was a
Right,
Muslim, I'm married to a
right,
Sikh, my
right.
aunts are white women. So it's very nice that people understand this. But when I
So,
talk about important subjects like this, it'll be
yeah.
two people who will comment. And that's the scary part.
See, that's where the stigma and the
Yeah,
just
so
the lack
that's
of
where the
awareness.
stigma is, and that's
Yeah.
what social media is. You only
And
want to
that's
hear
why
good news. Yes.
sometimes we find in our practice that we get more direct messages around this. People are not
Yeah.
confident to leave a comment, but they want a space where they can actually communicate in private. And I think that's a good first step. But I'm hoping longer term that we will be more confident and comfortable and recognize that this is just a medical condition. It's no different to asthma or us discussing diabetes or anything else.
Thank you, Talat.
Thank you
As
so
we,
much.
Thank you so much for joining me. It has been such a pleasure.
The pleasure is all mine. Thank you very much.
Thank you, Talat. Bye.
Take care. Bye bye.